Hi, this is Dr. Rogu from RBK Pediatrics again, with my third year medical student, Dr. Cyrus Davati from NYITCOM. He's preparing his little video presentation on common respiratory conditions in pediatrics. And we're going to tell you a little bit about what we see day to day in the office and some of his experiences in the office. And if you want to see it in the future, you can see it in an NYIT Wall of Fame on the rbkpediatrics.com website under social media button. Take it away, Dr. Cyrus.
Okay, thank you, Dr. Rogu. So, common respiratory infections. So why is this an issue? We have 12 million hospital admissions every year due to this. And from those, we have around a million, close to 1.5 million deaths. That being said, a majority of these deaths are in developing countries, but it is still a cause of concern, and public education regarding the matter is mandatory. So just having a general understanding of what to look for is essential for tackling each of these infections. So the first and most common one is asthma. It's generally just an inflammation and narrowing of the upper airways. As you can see in the diagram there, you can see the general airway constriction that occurs secondary to the inflammation. And there will be a lot of just general mucus buildup. A lot of these patients typically present with a wheeze, shortness of breath, symptoms of coughing. And they're generally exacerbated by allergens, right? So dust mites, pollution, pets, smoking, right? So a lot of parents who smoke can have kids with asthma, and they're generally advised to smoke outside of the house, to smoke away from these kids to avoid that initial exposure and symptoms. Treatment is varied depending on severity of symptoms. For those of those asthma patients who are very mild in symptoms, like less than 2 days a week, we generally recommend a short-acting beta agonist like albuterol. For patients who are a little more on the moderate side of symptoms, we recommend a long-acting beta agonist, and along with that, a possible low dose of a corticosteroid. For patients, on the other hand, who are daily asthmatics, right, constantly coughing, constantly wheezing, and even at night, like just, constantly experiencing those symptoms, we would increase our dosages of steroids to a high dose steroid treatment and a long-acting beta agonist.
Dr. Cyrus, I'd like to just interject here and say
Yeah.
some other common triggers are viral respiratory infections, such as flu, COVID-19, parainfluenza viruses, different things. The kids start off as a viral illness and they trigger an asthmatic attack. That's why it's very important for asthmatics to receive, their flu vaccine every year, and now with the COVID vaccine also from 5 to 11 and above.
Okay. Very good to know. Moving on, sinusitis. I am actually currently coming down from one as we speak. This is very common. Everybody's had it. It's just sinus inflammation, right, that causes blockage and fluid buildup. And it's generally secondary to a viral or upper respiratory infection that has lasted more than 2 weeks. I can just tell you symptomatically based on the things I've been experiencing myself. If you tap along your frontal and your maxillary sinuses, you can feel that general pressure and tenderness behind the bone that is, as you can see in the diagram, due to that buildup of mucus and fluid in those sinus holes. It's generally something that is treated more supportively, right? Decongestants, pain relievers, and just rest. Bronchiolitis, kind of like asthma in the sense that there is a more inflammatory reaction. However, this occurs more in the bronchioles, and it is secondary to respiratory syncytial virus, which is very common in kids. It's a condition that, like many others, right, starts as a cold, and from there it progresses on to, to coughing, to wheezing, to difficulty breathing, possible dehydration, and fever, right? Generally, infants are hit the hardest with this throughout the winter, and they can go and pass that on to their older siblings who generally tend to have more mild symptoms and aren't hit as hard as they as hard as the infants. Um, it is the most common hospitalization in infants. Uh, these symptoms generally present for around 7 to 10 days before coming to a full stop, to being fully healed after around 2 weeks. This is more, of course, like most viral infections, is treated a lot more supportively, right, with analgesics, um, with oxygen therapy, fluids if the patient is experiencing dehydration, and it does need to be fully treated because there's a lot of complications if not treated properly. This patient can have a secondary pneumonia, can have ear infections, and can progress to respiratory failure.
Cyrus, I'd like to interject. Children, bronchiolitis, RSV bronchiolitis is a very common event that we see in the pediatric office. How do you know which one goes home, which one gets admitted to the hospital? Because they all have a lot of noisy breathing, difficulty breathing. The little infants, they tend to have that wheezing, respiratory distress, the retractions. And then if they have poor feeding, they can't, maintain their caloric intake. And so basically respiratory distress with poor feeding and low oxygenation with low oxygen levels, like in the low 90s, high 80s, low 90s, that would be a cause for a hospitalization. If they're happily wheezing and they're feeding well, those kids can be managed at home. And in the hospital, we put them on some oxygen therapy until they get over this illness. And they do, the little babies that have a positive RSV at a very young age, they tend to be a setup for the future. There's a high propensity for them to develop asthma as they get older. Doesn't always mean it will, but sometimes it does happen. Board question.
Okay. Good to know. Very high yield. Okay. Croup. This is an upper airway infection that scares a lot of parents. It is very common in close to 3% of kids every year. And it is most commonly in kids around 6 months to 3 years old. And it's most commonly caused by the Influenza virus. This condition is pathognomonic for this kind of seal bark raspy cough that can be aggravated by coughing or crying. And along with that, patients may experience stridor, which is just like this harsh grating sound. So parents see that and they're like, what's wrong with my kid? They tend to go berserk about it. But so if you look closely at the diagram there is just this general swelling around the larynx and the trachea that causes these symptoms. And it makes it very difficult for inspiration and expiration, which is causing this characteristic hoarse voice, the seal bark cough, and the stridor. Cool mist inhalation has been found to reduce airway inflammation. And generally, besides that, we just recommend general home care and supportive therapy for these patients. Some complications of this, if not fully treated and if not fully healed, are secondary bacterial infections of the trachea. Besides that, that's just the main thing for croup is just that seal bark cough, which really differentiates that from a lot of other viruses that we've seen so far.
Usually in practice, what you'll hear is you'll get a phone call in the middle of the night of the child that had a little bit of a respiratory illness a couple of days ago, and he wakes out of a sound sleep with this barking, seal-like cough, and you can hear it on the phone. So you're supposed to instruct the patient, take the child into the shower, make a lot of steam, and let the child inhale that. And that usually helps to reduce that inflammation. And you can see that inflammation that's on the x-ray with the green marks. It looks like a little, it looks like the Washington Monument. It's called,
yeah.
So it's called a steeple sign, which is just constriction of the airway. And word question. And, you know, the inflammation, once the inflammation reduces, they breathe a little bit better.
Mm-hmm.
Okay.
Very good to know. Strep throat. Everyone's had it. It's one of the most common infections in kids, right? Presents with your classic symptoms of, you know, fever, headache, rash, body aches. It is something that needs to be treated very seriously. We generally give these patients a round of oral penicillin that needs to be completed, needs to be finished, because if it doesn't come to a full resolution, there is a list of complications that can occur. There's a common thing called post-strep glomerulonephritis. This generally occurs about 2 to 3 weeks post-infection, and patients present with hematuria and can also cause long-term kidney damage to the nephrons. And along with that, it can also progress to rheumatic fever, which can present with inflamed joints, rashes, and long-term heart valve damage. So this is definitely something that needs to be diagnosed early on and treated as quick as possible. Along with that, if you can see the diagram, some patients experience cellulitis, which is just this general kind of swelling and erythema that occurs around the infection site. And some patients may also experience impetigo, which is kind of this oozing and crusting that generally forms around the nose and the mouth, but can occur anywhere pretty much. The most common pathogen is Strep pyogenes, and it's something that we get a throat culture on. Kids hate to get it. You just take that stick and you got to put it all the way at the back of the tonsils to take that swab. I can't recall on two hands how many times kids have just cried and just hated that, but hey, you got to do what you got to do. So yeah, that's the main thing on strep throat. If you have anything else to add.
Well, you can see the throat. You'll get a lot of people that come in with their child. When they come in like this with the really red throat, that's called palatal petechiae, board question. They almost never come like this. When you see that, you don't even need a strep throat, but you just do it for confirmation. Many people will just show up with a sore throat, maybe plus or minus a fever, often abdominal pain and some headaches and poor appetite. When you get those symptoms together, it's probably strep throat. Right now, what we're seeing, we didn't see a lot of strep throat in the office during rotation because everybody's wearing a mask. So the amount of strep throat has decreased dramatically, and the treatment is the good old bubblegum amoxicillin or penicillin. Yeah.
Good to know. Influenza, a very common seasonal infection that kids experience all the time. It is generally a lot more severe than the cold and presents a lot more suddenly than the cold does. And along with that, patients will, of course, have your classic symptoms of fever, body aches, and chills. It has caused around, in 2020, it caused 380,000 hospitalizations and 20,000 deaths around the world. So definitely a cause of concern. General treatment is just rest, pain relievers, and analgesics. Tamiflu has been found to help shorten the duration of the disease and the spread of the virus in kids. Though you do need to be careful. Tamiflu itself can cause diarrhea, nausea, and headaches, so be careful with how much you use. COVID-19. All right, this brings us to our last condition, the infamous coronavirus. It has caused close to 5 million deaths around the world and continues to vary in form. I believe now we have the Delta variant that isn't as, that I believe is more resistant to the vaccine, if I'm not mistaken. And what makes it so contagious is, if you see on the diagram, this virus has these spike proteins that latch on to the inflammatory tissue and causes an autoimmune response and just a cytokine cascade. And it just causes this whole array of, fever, myalgias, sore throat, systemic systems, diarrhea. And as we have seen so far, it's more something that, kids will get. And because they have a strong immune system, they are very mildly symptomatic, if that. However, they come home, right? They see mom and dad, they see their grandparents, and they pass it to them. And they're not as strong in terms of immunity as their kids are, right? So they will catch it. And these complications will obviously increase with age. So in the older population, you could see acute respiratory distress syndrome, organ failure. Lung function itself has been shown to be severely compromised in elderly patients that were hospitalized with the virus. But in terms of kids itself, we have not seen too much at the RBK clinic. I believe since we started testing in September of 2021, around 13,000.
Actually, September 2020, Cyrus. September
Oh,
2020.
I'm sorry.
Yeah.
Excuse me. September of 2020, we've had about 13,000 tests performed. And of those, we had about 800 confirmed cases. So that gives us a 6% positive case rate.
Which is what's around
the right,
yeah.
Which is around the same as the general public. And as course of the kids we've seen in clinic that actually ended up testing positive, they had just your typical symptoms, if that, and we didn't have too many complaints of just pulmonary issues or just concerning symptoms that needed to be further evaluated. So that pretty much brings it to a close. If there's anything else on
with the coronavirus, the only treatment that you have for it today is to prevent it. So wearing the mask helps to prevent it. You see all the children, all the parents and doctors and everybody at the office, they wear the mask. That helps to reduce the transmission. But as you recall, remember the family with the 4 kids that came in all coughing and every single one was positive, and then the mother was positive? We've had cases where entire families are wiped out. Now, if they don't get sick, it's okay. If they just coughing and congested, it's not always like that. You have, I use the example of a personal friend of mine that the kid got the virus, came home, gave it to the mother, gave it to the father, gave it to the grandmother, and the mother got really, really, really sick to the point of almost intubated. Stayed in the hospital for about a month. That's a terrible case. Or the moms that were pregnant and got coronavirus during the pregnancy, that almost, if you remember that patient, and the child is okay now and the mother's okay, but it was a very rough road. They almost both passed away. So the severity of the coronavirus is from almost nothing to very, very deathly to death, basically. And the only way to prevent it is through the vaccines. So Cyrus, you worked at a couple of our COVID clinics. You may have even given some of the vaccines to some of the people that are watching this episode.
Did quite a few. Yeah.
We believe highly that these vaccines work. And hopefully next year, this time, there won't be so much of this coronavirus if everybody gets vaccinated. We'll see.
It's crossed.
All right. So I think we're good. If you have anything else to say,
that's about it.
I hope you learned something at the rotation, and
I learned. Absolutely.
Go forward and become a really good doctor and save the world.
That sounds like a plan.
All right. Thanks a lot.
I appreciate your time, Dr. Rogu.
Bye-bye.